have mercy. Well, you know, sometimes when the Eskimos up in Alaska, before the Americans took over the island and everything, and people got so old and became useless and everything, they would sort of put them on the ice and sort of let them just fade away. And I think what the people here have decided is they're going to give me some money and some good place, and I'll be able to eat myself away from But in gratitude to all of you, I really appreciate this, and it truly is a surprise to me because I was just thinking I had 8 progress notes to finish this evening. And I was going to use my time this evening after the Joint Staff meeting to go back to the office and finish those 8 progress Oh, boy. Well,
we wish you the best, Dan.
I just know that it's such capable hands, you know, because we struggled in mental health for years. You know, we had like 5 people in mental health. And sometimes we had like 5,000 and 6,000 cases. And I'm going to tell you the truth, I felt that no matter what we said to the administrators, that we were doing the veterans a disservice, because there were a lot of times that Dr. Nagel and myself and Dr. Johnson, the 2 psychologists, we would see like 35 and 40 patients. I think one day I saw 46 patients in one day. And I'm going to tell you how cheating that was. I'm sitting down and trying to do new people that I'd never seen before, and I'm trying to explain to them that due to the time limitations and the lack of our staff, they could go to Murfreesboro, and they would say to me, I'm not going to drive to Murfreesboro. And I said, well, sir, it's probably going to be about 5 minutes with me, and I'm writing so fast, trying to do a psychosocial and making mistakes in the grammar and all that kind of thing. But the key thing was the doctors, the medical doctors here were so nice to us. We didn't have a psychiatrist for about 6 years, and Dr. Haygood came once a week on Thursday, and he would write all the orders for us without ever seeing the patients. And then we'd have to go to the primary care doctors, and they were kind enough to go ahead and write the orders for us for our psychiatric patients. And when Dr. Burke got here, and we went to him and talked to him and said, you know, we really need a lot of staff. He said, well, you know, I haven't seen the numbers. And so I said, well, I'll get the secretary to pull up the numbers. And she pulled up the numbers, and he saw it, and he said, well, you need 16 or 17 people here to try to treat these people. And he started to bring 2 or 3 psychiatrists on a temporary basis down here from Murfreesboro to Nashville, and then he brought 4 or 5 nurse practitioners, and then he got Dr. Lloyd to agree to come down here to take over mental health, and then they started to bring on other staff and everything. And eventually we've gotten vocational rehab thanks to Dr. Rose and Chris Atkins. They were really bulldogging on that. And I'm going to tell you, it has made a tremendous difference because the people don't have to rush all the time. And it's like you got enough people where you can competently treat people and they don't feel like they're under the gun all the time. That makes a big difference, especially in mental health. And I think it has made a tremendous difference for the medical doctors because they know they got a resource that they can come to mental health. And so with people working together, it's made it so much better that I can see the difference in mental health now that we've got the staff and we got the cooperation between the medical doctors and our mental health staff, and we can actually treat patients. Before, it was like a fire drill, and it was like hit and miss, and so many people fell through the cracks. I felt ashamed, and I always thought that somehow somebody's going to come back and say, why y'all didn't call these people? You said they were thinking about suicide and everything, but we were just under the gun. We were rushing so fast to treat new people that was coming in. A lot of time we couldn't follow up on the old people. Now we got Jack Morrison doing that. Now the suicide prevention people are also helping out. But at least we got enough staff down here where I know that we can treat people competently and professionally, and that makes all the difference in the world. And so I'm just so proud and happy of that. if I go to my grave tonight, I will feel that we've achieved the purpose that I think we should have had when I first came into the VA. And we finally got to that point where at least we can treat people competently and not go home thinking that somebody's gonna fall through the crack and they're gonna say, hey, you're to blame for that because you didn't do what is professionally required to follow up with these people. And we got that kind of staff now that we can do it. So I'm really proud